Hello everyone, we are from group H and introduce myself. My name is Farhan Nurul Hakim and my student ID is 234101043.
Hi, my name is Puji, Delya, Lestari and my student ID is 234101108.
Hello everyone, my name is Salwa, Hilwana, Sephianti and my student ID is 234101036.
Hello everyone, my name is Raya, Ghefira, Azra and my student ID number is 234101111.
My name is Fahruniaji Nugraha, my NPM 234 11 10 14.
Okay, the reason why we choose the title Determining and Influencing Public Health in Indonesia with tuition because it provides a focus on determining the factor that influence public health in Indonesia, as well as how to positively influence them. This can provide an in-depth understanding of the health challenge faced, potential intervention that can be made to improve overall health condition in Indonesia.
Genetics and biology, type 2 diabetes has a strong genetic link, and individuals with a family history of diabetes are more likely to develop the condition themselves.
Next, there are health determinants, namely health behavior. That behavior can affect our health, such as lack of sleep. Many Indonesians lack of sleep for various reasons such as work, entertainment, or other bad habits. Lack of sleep can cause health problems such as fatigue, mood disorders, decreased immune system, and other health problems.
Or societal characteristics, people's income, education, and employment levels can influence their access to health service, nutrition, food, and a healthy environment.
Health service or medical care. Good health service can provide prevention, diagnosis, and appropriate treatment for disease and health conditions.
Okay, counseling in education. Counseling play a vital role in health education, from nutrition counseling to promotion active lifestyle. Counselor help disseminate important information to increase public awareness of the importance of staying healthy. Mental health is equally important. Counseling helps identify and treat problems. Finally, counseling collaboration with educational institutions essential. The integration of counseling in the curriculum, teacher training, and counselor in school form the foundation for creating educational environment that support health and well-being.
Medical care in Indonesia effort to improve health status mother and child is one of the priority program. This is because maternal and child health problems are still one of the main problems in the health sector. Effort to improve the health status of mother and child target at reducing the death rate and incidence of illness in mother and child. To accelerate the reduction in maternal and child mortality rates, this is done through effort to improve the quality of service and maintain the continuity of maternal health service and referral service. The main cause of maternal death are hypertension during pregnancy and postpartum hemorrhage. Meanwhile, the cause of the high infant mortality that is due to fatal death in the womb, low birth weight, pneumonia, and diarrhea. Therefore, medical care for mother and children is very necessary, especially in Indonesia where there is a national child and food program that work in the health sector which concern the service and care of pregnant women, maternity, mother, breastfeeding, mother, baby, and children and personal children. Thank you.
Secondly, there is a lack of awareness of cleanliness and sanitation which can cause the spread of infectious diseases such as diarrhea, respiratory infections, and skin disease. Examples of prevention medicine in Indonesia are the Indonesian government also make prevention efforts through preventive and curative health service, hospital health promotions, disease prevention and control, as well as promotive and prevention in the health sector, such as health checks at community health centers and posyandu.
The habit of drinking alcoholic beverages is detrimental to health. Alcohol addiction occurs when alcohol makes change in the brain. This change will increase the sensation of satisfaction when the person drinks alcohol, thus triggering him to drink more often and resulting in addiction. Too much alcohol consumption itself can reduce thinking ability and behavioral disorders. If the consumption is excessive, it can cause a person to lose consciousness, seizures, and death. Other serious illness caused by alcohol include stomach ulcers, liver damage, and complications of severe psychiatric disorders. Therefore, we must be careful and avoid consuming alcohol in order to avoid this disease.
Factor can have a significant impact on public health. In Indonesia, Papua province is an area that is quite underdevelopment in the health sector. According to the head of the Papua province health service, Aloysius Giai, he realizes that there is no need to talk about advanced treatment for cardiovascular disease, even though Papua is still far behind in sanitation problems. Problems with education and health service in the province of Papua and West Papua are two main topics in various development planning discussions. Infrastructure problems and unequal distribution of health workers are the roots of problems that cause each other. In the province of Papua and West Papua, not all districts or cities have regional general hospital. Community health centers generally tend to be concentrated in urban areas or districts that have existed for a long time. Unavailability and operation of regional general hospitals in several districts means that people have to be referred to hospitals in other districts. This condition certainly has implications for quite high operational costs. Sick people seeking treatment will also usually be accompanied by family or combination. The cost of access health service is becoming increasingly expensive. The extensive geographical condition in the front of hills and mountains mean that health service for indigenous populations infrastructure includes inadequate road infrastructure and limited transportation facilities, so that the mobility of indigenous Papuans or health facilities is greatly hampered. The lack of availability of supporting facilities for health service, such as electricity, clean water, and telecom communication, often hinders the use of health equipment. So economic factors play a big role in health in